Um, Pandemic. It's a word you see often in today's headlines. It is very prevalent in what is going on with the world globally. Not only just here in the United States and in states like Nebraska, but all across the world in countries such as Italy and China and even countries in Africa like Rwanda are all dealing with their own version of the pandemic that is COVID or coronavirus disease 2019, which is abbreviated by COVID-19. Now, one of the main problems that COVID-19 has caused is an increase in mask need. So people like surgeons and doctors and even dentists in the medical field do not have the resources they need as far as proper equipment, such as masks, due to shortages from the pandemic. Now, originally, government agencies like the CDC talked about how masks are important and that everyone should be wearing a mask. And while yes, that is still true, they failed at first to say exactly what kind of mask. So the surgical masks and the N95s that are often used in the healthcare world and still need to be most used in the healthcare world are in very limited supply. They've been having lots of problems and they've needed to have to restock and have companies that don't normally supply masks ramp up productions and try to fulfill those needs. And this is all because of COVID, because of the sudden and dramatic effect this pandemic has had on the United States and globally, as I said before. Hufford and Evans from the Wall Street Journal said, and while hospitals and health systems say they can more easily access masks than in the early days of the epidemic, overall demand still exceeds supply. So this means that even now, even months into this, we're still short masks. We still need way more than what hospitals and health agencies and health systems all throughout the country are getting. And that just shows how important and vital masks really are. So a good solution to this problem is the general public made cloth masks. If we started using cloth masks instead of the ones you buy in store, like the N95, if normal people, everyday workers who weren't in the healthcare system use cloth masks every day and then you just wash them every so often, that would greatly decrease the amount of masks, surgical masks and N95s that are being bought. That would allow a lot of that supply to move into the healthcare system. And a lot of the reason that a lot of the N95s and surgical masks are being bought up was because of the CDC's initial statement saying that's what you needed. But as Nina Baya from the University of California, San Francisco said earlier this year, what may have finally convinced the CDC to change its guidance in favor of masks were raising prevalence and a clear understanding that both pre- and asymptomatic transmissions are possible and even common. Now, so that tells us that masks are as important as we believe that they are, and it is essential that everyone uses masks, because even if you're not feeling well, even if you don't think you've been exposed, just breathing within 6 feet of another person could put you at risk, could give you coronavirus, just from talking to them without a mask. So having a mask, even cloth masks, can really reduce the amount of particles and germs that we're expelling and exposing to different people. And the CDC also said a very common way that the virus is spreading is through community spread, which is, as the CDC defined it, is when people in the area do not know how or when they became infected. And now that's a big problem, because if you do not know how or when, then you may think that you have not been exposed, that you do not need to worry about it, when really it's that very thinking is why we need more masks. It's because this coronavirus is so adaptive and affects everybody differently that the importance of masks is just so high. And they're really the solution for getting these numbers down and helping the hospitals and healthcare workers so that they're not in short supply and scrambling more than they already have to. Robin Gavine said, masks don't need to be another hurdle.